Hello, 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 check, hello, 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 check, hello.
Ready?
Good afternoon, all the faculties, fellow colleagues, and the residents. We feel immensely proud and privileged to invite Dr. Aditya Maheshwari. He is currently Associate Professor at SUNY America. He is the Director of Adult Reconstruction and Orthopedic Oncology Program in the department. He is a board-certified orthopedic surgeon and specializes in musculoskeletal oncology and the adult joint reconstruction. He is the alumnus of UCMS and he did his residency from 2000 to 2003, and after that he did his senior residency for 1 year in this institution. He is a renowned international faculty and is invited as guest faculty in many national and international conferences. He has more than 130 peer reviewed manuscript to his credit in more than 17 international journals and has more than 18 chapters to his credit. He has been actively involved in the teaching of more than 78 residents, orthopedic residents, and many of medical students. He has established musculoskeletal oncology program at SUNY and Kings County Hospital Center. Sir, we welcome you here for enlightening us about the adult reconstruction, the present, the past, and the future.
Good afternoon, everyone. Thank you so much for having me, and it's almost like a homecoming, as you rightly said, 2000 to 2005. We were the millennium babies here, Y2K, me and Jatin. I see Dr. Asha here. Dr. Asha was my classmate at MAMC, actually. So let's go to the next one. Of course, I have to do this, so there's no disclosure. So it all started, you see, it keeps on happening again and again. So it all started June 29, 2023, when I was in Pittsburgh. I was visiting Pittsburgh as a MAMCOANA, which is actually a MAMC conference, alumni conference, which happens in the US every year. And sir was there visiting his son, Ayush. So बात हुई और पता चला कि सर टाउन पे तो of course मिलना तो था ही. So we had this a great reunion between me and sir, and this picture was taken by actually Shikhar Soni, who is also one of my batchmates from MAMC. He's a very nice photographer. And of course, you see, I salute my guru every single time I see him. So, sir se baat hui, and then we discussed ki, what are the topics that I could probably talk and, come here and talk. And he knew that I was coming here this week. So we talked about total joints and बात हुई कि क्या change हो रहा है, what is happening in this world. And having said so, sir went through his personal experience a few months ago, and look at him, पता भी नहीं चलता कि कौन सा पैर left है, कौन सा right है, कौन सा क्या चल रहा है, we didn't know. So we talked about कि इस पे बात करते हैं past, future और present में. तो लगा कि थोड़ा सा इस पे spice डाला जाए, because this talk will be intended for general public as well, not only orthopods. So थोड़ा सा spice डाला जाए इसमें, so that everybody gets a little bit interested. Because let me ask you, कितने लोगों के घर में या किसी को जानते हो जिनका joint replacement हो चुका है, hip or knee, I mean, right? I think there are a lot of people who at least know about what's happening. तो फिर हमने डिसाइड किया कि चलो ये बात कर सकते हैं, it's not your parents' hip or your grandma's hip. तो मैंने गूगल किया तो पता चला कि ये चीज़ तो पहले से it was already taken. There are so many, गूगल करते ये सारी चीज़ें आ गई. Not your parents' hip, not your grandma's hip. That means things are changing, right? Not your mother's hip. Not your mom's hip, sorry, एंड ऐड के चक्कर में कुछ इंस्टीट्यूट तो इतने एक्साइटेड हो गए कि उन्होंने ये 100 ब्लेड ही उल्टी लगा दी. दिस इज रोबोटिक थिंग. अब सर्जन इज एक्चुअली कटिंग हिमसेल्फ. सो एंड ये हमें एक साल पहले पता चल गया था कि ये प्रॉब्लम है, एंड दिस इंस्टीट्यूट नोज. पर आज की डेट में भी आप गूगल करोगे तो यही पिक्चर आती है उसमें. तो दैट शोज मार्केटिंग के चक्कर में लोग क्या करते हैं और सब उल्टा पुल्टा है. सो उल्टा पुल्टा किसको याद है? उल्टा पुल्टा यूज्ड टू बी अ सीरीज ऑन दूरदर्शन. DD2 से स्टार्ट हुई थी. एनीबडी रिमेंबर्स उल्टा पुल्टा? नाइस शो. सो वी डिसाइडेड कि चलो हम इसको थोड़ा सा इंडियन स्पाइस डालते हैं, टच करते हैं. तो विल टॉक अबाउट कि जॉइंट रिप्लेसमेंट 2023 में क्या है. कल, आज और कल. कल, आज और कल का नाम याद आते ही आई थिंक लॉट ऑफ अस विल रिमेंबर दिस मूवी, राइट. दिस इज अ 3 जनरेशन ऑफ कपूर्स ऑल टुगेदर. और उसमें एक सॉन्ग भी था. ये वीडियो से कनेक्टेड है क्या? नहीं हो पाएगा. ओके. एक्चुअली दिस इज़ अ सॉन्ग फ्रॉम दिस मूवी, एंड इस मूवी में काफ़ी अच्छे गाने थे. जैसे आप यहाँ आए किस लिए, तो आप मुझसे पूछ सकते हो किस लिए. तो मेरे लिए तो होम कमिंग है. भोरे की गुंजन है मेरा दिल, राइट. हम जब होंगे 60 साल के और तुम होगी 55 की. तो दिस इज़ समथिंग लाइक कि उस ज़माने में एक SR और इंटर्न का रोमांस चल रहा होगा, राइट. 5 साल का फ़र्क होगा, 3 साल की SR शिप इंटर्न, और इधर निकल रहा है और टिक टिक जाए घड़ी. एंड ऑफ कोर्स हिप ओनी रिप्लेसमेंट में इसमें एक गाना ये भी था, एक पाँव चल रहा अलग अलग. सो नाउ यू हैव ए हिप ओनी रिप्लेसमेंट, देन यू कैन हैव दैट. So 2000, right? Let's give you a brief. What was happening in 2000? Of course, 2000. I was here. I think Jatin joined in what 2003. 2002. So Jatin came after me as I was a PG, so I was a first year PG in 2000. A lot of things were happening in 2000. सबसे बड़ा डर लग रहा था कि भाई क्या होगा. Y2K है, मिलेनियम है, कंप्यूटर उड़ जाएंगे, क्या होगा, प्लेन गिर जाएंगे ऊपर से, रॉकेट उड़ जाएंगे. सोनी का प्ले स्टेशन आया था. कितने लोग प्ले स्टेशन खेलते हैं यहाँ पे, राइट. इंटरनेशनल स्पेस स्टेशन का क्रू था. अमेरिका में बुश और अल्गोर का बहुत तगड़ा डिबेट और इलेक्शन था. सिडनी में ओलंपिक्स हुए थे. वर्मोंट में सेम सेक्स कपल का लीगलाइजेशन हो गया था. मिलेनियम ब्रिज खुला लंदन में, और इतनी भीड़ चढ़ी कि ब्रिज कांपने लगा, तो उनको बंद करना पड़ गया कुछ दिनों के बाद. कॉनकॉर्ड का फेमस क्रैश हुआ था, द ओनली कॉनकॉर्ड क्रैश दैट हैपेंड देयर. बिल गेट्स ने अपनी CEO की पोजीशन छोड़ दी थी. पोप जॉन पॉल टू इजराइल गए थे, उस ज़माने में बड़ी बात थी. मोबाइल फ़ोन एसेंशियल बनने लगे थे. पनामा को पनामा कैनाल मिल गया था. टाइगर वुड ग्रैंड स्लैम बन गया था. ब्रैड पिट वाज वोटेड द सेक्शन मैन अलाइव, और यहाँ मैं था जो UCMS आने वाला था. सो दिस ऑल हैपेंड इन 2000. सो दिस इज हाउ आई केम. इफ यू गाइज आर फ्रॉम मौलाना आजाद मेडिकल कॉलेज, यू वुड प्रॉब्ली रिमेंबर डॉक्टर MP सिंह. ही वाज इन द डिपार्टमेंट ऑफ मेडिसिन. तो उन्होंने ये फ़ोटो एक्चुअली मेरी PG एंट्रेंस के फॉर्म की है, तो उन्होंने अटेस्ट किया था. तो दिस इज़ माई फॉर्म. एंड ऑफ कोर्स 2000 से 2005 आई वॉज हेयर, एंड दिस इज़ माई होल जर्नी. मैं MMC से आया. ये मेरी बाइक होती थी. दिस इज़ हाउ आई केम हियर एक्चुअली. ये MMC में घुसने के पहले एंट्रेंस एग्ज़ाम की मेरी फ़ोटो है. इसमें DPS की वाइस प्रिंसिपल होती थी डॉक्टर श्यामा चोना. आप लोग DPS से हो, RK से कोई, तो आपको याद होगा या शायद नहीं भी हो. दिस इज़ माई पिक्चर, एंड दिस इज़ ऑफ कोर्स MMC. दिस इज़ रामकृष्णा विहार. आई यूज्ड टू लिव इन Patparganj. आई स्टिल लिव इन द सेम एरिया, एंड ऑफ कोर्स दिस वाज जर्नी फॉर मी. हियर UCMS यहाँ था. एंड जब मैं आया था तो ऑफ कोर्स आई हैड दिस एस्टीम्ड फैकल्टी. हाँ, तो ऑफ कोर्स डॉक्टर जैन इज स्टिल देयर, डॉक्टर धामी इज स्टिल हेयर, डॉक्टर अग्रवाल इज स्टिल हेयर, डॉक्टर मनोज थे यहाँ पे, डॉक्टर अनिल रोड़ा थे, डॉक्टर मनीष चड्डा शायद हैं पर यहाँ नहीं, यहाँ ही स्टिल देयर. डॉक्टर शोभा थी, डॉक्टर कुमार थे. हमारा UCMS था. सो 22 में 2000 को मेरी जर्नी शुरू हुई थी UCMS में. वार्ड 20 अभी भी वार्ड 20 फेमस वार्ड 20 है. और उसके बाद फिर हमारी मेरी जर्नी ऑर्थोपेडिक में सर के साथ शुरू हुई थी. एंटी वर्जन के बारे में तो उन्होंने पहली बार पूछा कि तुम्हारी थीसिस से एंटी वर्जन देंगे, तो मुझे तो समझ में नहीं आया कि होता क्या है एंटी वर्जन. पहले तो गूगल करो इसको. तो ऑफ कोर्स दैट वाज अ ग्रेट टाइम. एंड ये सब मेरी थीसिस की पिक्चर्स ही हैं उस ज़माने की. एंड ये सारे द मल्टीपल डेज, मल्टीपल लेट नाइट्स, ये कैलकुलेशन करते रहो, CT कराते रहो. रेडियोलॉजी से डॉक्टर भार्गव वाज हेड ऑफ डिपार्टमेंट, राइट. रेडियोलॉजी में थे डॉक्टर भार्गव. उनके साथ टाइप था. एनीवे कई और हमने परिणीता के गाने सुनते हुए निकाले. सर को पुराने गाने बड़े पसंद थे. किशोर कुमार, लता मंगेशकर, नव परिणीता. और जब मैं था तब वो सचिन तेंदुलकर ने शोएब अख्तर को बहुत तगड़ा छक्का मारा था साउथ अफ्रीका वर्ल्ड कप में. वो भी सबको याद है. तो देयर वाज फन टाइम एक्चुअली. एंड ऑफ कोर्स दिस इज़ अ कॉपी ऑफ माई थीसिस. दैट वाज क्वाइट थिक एक्चुअली. और एक बंदा होता था राहुल धनेजा करके, आई एम नॉट श्योर आप में से किसको याद है. वो टाइप करता था उसका. अभी भी कर रहा है. अच्छा, आज भी थीसिस टाइप होती है. हाँ, तो मैं जूनियर्स के लिए बोलना चाहता हूँ, पूछेंगे कि भाई तुम टाइप क्यों करवाते हो, खुद क्यों नहीं करते हो। हमारे टाइम में हाँ, एक बंदा बैठता था रात के 2-3 बजे तक, उससे अपॉइंटमेंट लेना पड़ता था, वो टाइप करता था। तो वो कहता था कि भाई तेरी मोटी थीसिस तो मैंने आज तक नहीं देखी, और सर को लगा कि इसकी थीसिस तो टाइम से जाएगी नहीं, तो मेरे को तुम एक्सटेंशन लेना शुरू कर दो भाई। लेकिन एवरीथिंग वेंट वेल, एंड एवरीथिंग वेंट वेल। देखो डॉक्टर कुमार ने मुझे टेस्टिफाई किया यहाँ पे कि हिज वर्क एंड कंडक्ट हैज़ बीन गुड थ्रू आउट। सो मैं गंदा बच्चा नहीं था, राइट। ये मेरी जीटीबी की लास्ट पे स्टब है। सर को 10,000 रुपये मिलते थे उस ज़माने में, बेसिक होता था हमारा। दिस इज़ 24 October 2005 एंड ऑफ कोर्स आई ग्रेजुएटेड and that was my last day. So I came like this, I went out like this, so we need we whatever you want to say. और उसके बाद भी काफ़ी स्कॉलरली एक्टिविटीज़ चलती रही सर के साथ और डिपार्टमेंट के साथ। सो देयर सम ऑफ द पब्लिकेशंस दैट वी डिड, एंड बिफोर एंड आफ्टर, और निकलने के बाद भी वी हैड सम कॉमन पब्लिकेशंस, तो चलता रहा। These are some of my personal pictures with my department favorites. Of course, I got married when I was a PG, so very सबकी पिक्चर है। डॉक्टर कुमार है, डॉक्टर मोंगा वाज एन SR मेरे टाइम में, डॉक्टर जैन है, ये क्रू था। ललित इज़ देयर, रविंदर इज़ देयर, सर तो हैं, सर डॉक्टर धामी इज़ राइट हियर, एंड ये कुछ अवार्ड थे। एंड ऑफ कोर्स ये यू गाइस रिमेंबर दिस गाइस, कोने में दुकान होती थी विकलांग 6 नंबर की दुकान होती थी, राइट। तो ये उनका क्रू था। एंड ये जतिन, आई थिंक दिस इज़ योर फेवरेट, आई गेस, राइट, दिस इज़ योर फेवरेट, एंड दिस इज़ हाउ आई केम। दिल्ली से लॉस एंजल्स का सफ़र था मेरा। दिस इज़ डॉक्टर लैरी डोर, जिनके साथ मैं पहली बार ट्रेन करने गया था। अनफॉर्चुनेटली ही पास्ड अवे a couple of years ago from COVID, and after that I actually went to the legendary, this is Dr. Ranawat, जिनके साथ एक साल टाइम बिताया था मैंने। तो सर्कल ऑफ लाइफ है। माई सन ईश वॉज एक्चुअली बॉर्न इन GTB। 20 जुलाई 2002 में ही वॉज बॉर्न, एंड हमने एक प्राइवेट रूम लिया था। 23 नंबर के वार्ड में एक औरतों का प्राइवेट रूम होता था उस ज़माने में। एंड ये वो है, ये मेरा ग्रेजुएशन है, और इस साल एक्चुअली ही ग्रेजुएटेड दिस ईयर, सो दिस इज़ हिज ग्रेजुएशन सेरेमनी। दिस इज़ ईश नाउ, ही ग्रेजुएटेड फ्रॉम स्टैनफोर्ड कंप्यूटर साइंस में इस साल। तो सर्कल ऑफ लाइफ है, एवरीथिंग कम्स बैक। ऑलराइट, सो लेट्स नाउ टॉक द रियल थिंग, राइट। तो ऑर्थोपेडिक्स पे लेक्चर, वो भी लंच के बाद। अभी किसी से बात हो ही रही थी मेरी, एंड भाई चलो ठीक है, विल ट्राई टू मेक इट एज फन एज पॉसिबल। ऑलराइट, लेट्स गेट स्टार्टेड। हु नोज दिस गाय? Huh? Elon Musk, one of the genius guys, right? Anyway. So for the other juniors who are not from orthopedics, like I'm talking about joint replacements, hip and knee replacement, right? So what is a total knee replacement? So just a basic slide. So this is an arthritic knee. यहाँ पे आप देख सकते हो, कोई फर्स्ट ईयर PG है यहाँ पे? इस समय नहीं होगा ना कोई PG ऑर्थो का? Orthopedics PG? Can you just read this extra for me, please? No pressure. Just read it. Right? So Ward B's में एक सेमिनार रूम है, right? Have you been there? You are a first year PG, right? तभी तो 3 महीने ज्वाइन किया कब? हाँ? तब अभी तो न्यूबॉर्न बेबी है अभी तो ये, right? कोई बात नहीं, इट्स ओके, इट्स अ गुड एफर्ट, थैंक यू। बेसिकली Ward B's में दिस इज़ वाई द ट्रेनिंग इज सो इम्पोर्टेंट, राइट। क्योंकि हम जितने लोग यहाँ से निकले हैं, अगर एक्सरे हम रीड करेंगे बोलूँगा 80% हम सेम तरीके से ही आएंगे बाहर, सेम चीज़ें ही बोलेंगे, बिकॉज दैट इज़ हाउ वी आर ट्रेन्ड एंड इट हेल्प्स, इट रियली हेल्प्स इन गोइंग फॉरवर्ड, राइट। तो इसमें हम एक्सरे पहले बोलेंगे कि भाई क्या ये बायलैटरल नी का एक्सरे, राइट, AP एक्सरे है, स्टैंडिंग है या वेट बेरिंग है, नहीं है, इसकी बात करेंगे। एक बच्चे का है, एडल्ट का है, फाइसिस खुली हैं नहीं खुली हैं, इसकी बात करेंगे पहले, राइट। तो वी आर नॉट गोइंग टू द ऑब्वियस, क्योंकि जैसे आप सबसे पहले ऑब्वियस देखते हो तो सबको दिख रहा है, यू ट्राई टू स्किप थिंग्स, वो दिमाग फिर फोकस हो जाता है, राइट। तो वो तो दिख ही रहा है। देन देयर इज अ पैटर्न दैट वी टॉक अबाउट कि भाई या तो आप अंदर से बाहर हो या बाहर से अंदर आओ, सॉफ्ट टिश्यू से बोन पे जाओ या बोन से सॉफ्ट टिश्यू पे आओ, बोन क्वालिटी पे आओ। तो हैविंग सेड दैट आई विल जस्ट समराइज दिस इज ये एक्चुअली केस आने के जस्ट एक हफ्ते पहले का ही है, अपने डेट भी देख रहे होगे 9/20, सो 2 हफ्ते पहले का, स्टेपल्स भी लगे हुए इसमें। सो इसमें क्या हो रहा है, दिस इज नेक्स्ट ऑफ एनी, एवरीबडी रियलाइजेज दैट, राइट। फीमर है, टिबिया फिबुला है। व्हाट्स हैपनिंग हियर इज ऑफ कोर्स there's a reduction of joint space, we see some subchondral sclerosis going on, कुछ cyst भी बने हैं, और ये देखो knee subluxed भी है। Look at how the lateral condyle is compared to this, so this part was supposed to be here, तो knee subluxed भी है, So this is a patient जिसको हमने replace किया. So this is AP, lateral view, same thing है, patella यहाँ पे है. So इसका BMI थोड़ा high था. I think BMI was 44 or 45. So we did a staged bilateral 1 week apart. So that's his knee. So you could see how this part of the cartilage was resurfaced, and this is the metal implant that goes in. And look at the alignment. यहाँ पे varus deformity है, यहाँ पे straight हो गया है. That's what it is. And this is how a normal bone looks like. So that's why this is how a knee replacement in general works. Okay. Now, anybody else wants to take on this one? So let's talk about what a hip replacement is. Any final year medical students? Sankalp? Sankalp is what? First year PG? Then you are the right guy for this. Just read the X-ray for me. Let's start from here. This is the patient. This is a normal X-ray just for comparison, right? And this is what was done.
So this is X-ray pelvis 80 views depicting both the pelvic bones and proximal part of both the femurs with reduction in the joint space on the right hand side of the hip joint with
Maybe the pictures ज़्यादा clear नहीं है. अगर ये लाइट है स्पेशली बंद हो सकती है. It might be clearer, but ठीक है, it's okay. But आपने देखा कि he is going in the same direction as I was going, right? So पता चलता है बात करके कि भाई ये भी GTB का ही बड़ा हुआ है. So yes, so you're right. Yeah, much better now, right? So as you can see, there's a problem on this side compared to this side. There's a problem, right? So same चीजें हो रही हैं. Reduction of joint space है, osteophytes बने हुए हैं, कुछ cysts बने हुए हैं, subchondral sclerosis है. So this lady has a primary osteoarthritis, and she had a replacement. So basically, what you do in hip replacement is you replace on the other side of the pelvis, which is the socket. In this case, we had to put one screw, and this is the femur side. This is a press fit or a non-cemented implant, where the bone will grow, on-grow into this implant, and that's what a hip replacement looks like. Well, let's talk about some demographics. Why is this topic so important? Why am I here today talking about this hip and knee replacements in front of this esteemed crowd? The statistics are actually very mind-boggling. Almost half of the US, the minute pass data US का है because US has more data and it's more databases ज़्यादा है, तो data collect करना थोड़ा आसान होता है वहाँ पे. तो almost half of the US adults will develop a knee arthritis in at least one of your knees in their lifetime. So 1 in 2. Hips के लिए ये data 1 into 4. Okay, 1:4. Almost about 1 million primary hip and knee surgeries are being done in the US every year. 700,000 or 7 lakh knees or almost 350 hips. India ka data, I tried to look, there are multiple sources based on 2019-2020 data. 2 lakh se 3 lakh is the number. That's what I got on internet. So just compare. And this is projected to grow. So in 2030, this whole number for the US will grow at least 1.5 to 5 times, so different depending on what projections you look, किसने project किया, कौन सा model use किया. Almost 3.4 million total knees, or almost 500,000 total hips का number है. तो जब इतनी सर्जरियाँ होंगी, so we need to know about what's going on. And it's interesting that this article was actually published in the Lancet, which is one of the top-notch journals in the world. And total hip replacement was called the operation of the century. When I say century, means 20th century, because of its ability to improve the quality of life. So cataract surgeries हैं, कुछ cardiac surgeries हैं, और hip replacement है. These 3 are the top surgeries that can actually change the quality of life and improve the quality of life. I see Dr. Minanini, how are you? Nice seeing you. All right, so let's talk about history and evolution की ये कहाँ आ चुके हैं हम लोग, right? And who knows this guy? Probably everybody in the world. So what we learn from history is that people don't learn from history. It's a very important quote, and this is exactly what's happening. Now, total hip replacement is not a new or a relatively new surgery. If you go back to the real evolution, this is almost 125 years old, 1891, and they have used almost everything. They had used ivory, they have used metal, they have used different kinds of metal, stainless steel, plastics, Teflon. In fact, when John Charnley, so this is called John Charnley, he was the father of modern total hips in the 1960s. So when he was playing around and experimenting, he was using Teflon And when Teflon degrades in the joint, it releases formic acid. Now, formic acid is the same chemical that's secreted by ants when they bite you. So just imagine कि patients को क्या feel हो रहा होगा कि hundreds of ants उनके अंदर अचानक काटना शुरू कर रही हैं. So this is what it is. So Sir John Chanley is actually the father of modern hip replacements, and this is all the pictures कैसे evolve हुआ सब कुछ. Same with total knees. ये भी 150 साल पुरानी surgery almost, and कई चीज़ें use की गई हैं. Initially it was for infection, TB and all, and there are different models that I've used. And of course, in the modern world, it all started in the 1970s by Dr. Walker Ranawat and Skull. So this is Dr. Ranawat. This is with me in his fellowships, and this is of course Atal Bihari ji, जिनका knee replacement Dr. Ranawat ने किया था early 2000 में, and after that the joint replacement just boomed in this country. And that's the reason I went out कि आके यहाँ पे hip knee replace करूँगा, तब तक market settle हो जाएगा. Anyway, so क्या बदल गया? What has changed in the last 120, 30, 40 years, right? Although there is no progress without change, but not all change is progress. We have to know that too. So क्या बदल गया? Let's talk. From a surgeon's point of view, क्या बदल गया? Today's surgeon is much more confident than what it was 20, 30, 40 years ago. It's about experience, right? Indications have widened a lot. In the past, you would choose your patients very wisely. In fact, with Dr. John Chanley, his indications were very, very selective, rheumatoids and very, very debilitating patients. But now his indications have widened a lot. Technology has improved. Implant tribology has improved. Metallurgy has improved. In fact, when this hospital for Special Surgery was opened in 1863, excuse me, it was called the Society for Relief of the Ruptured and the Crippled. So this is what the orthopedic hospital used to be called. So what has changed on the patient's point of view? Now the surgery is more, patients are much more accepting, they demand it now, right? There's a lower threshold for total hips and knees. Patients are much younger, and they come, they tell this is what they want. It's a very active lifestyle, so the 60s is the new 30s, right? When we say people are living 60s, they are doing everything what people used to do 30, 40 years ago in their 30s. Increasing expectations, everybody sees the video, everybody sees all the good videos, like it's like a fashion show, right? Whatever that model wear, they will look good anyway. So everybody sees good videos, they see everybody is doing good things, so expectations have increased a lot. On the other hand, we are also now facing increasing comorbidities. So patients are actually sometimes sicker when they come for these surgeries, so because our selection has gone down too. So patients are more obese, heart disease, diabetes mellitus, and even in younger patients, we are having these problems. So, you know, another quote, unless you have wine or cheese, age does not matter. And in the orthopedic department, we are blessed with some of our mentors who seem to follow this. They are wine, they are cheese, and they don't age at all. All right, so let's talk about some of the data. So this is the Medicare data. In the US, Medicare is a nationalized healthcare system that everybody over 65 gets. And some other patients also get. So they have other databases as well. So if you look at these numbers, so I'm going to just summarize it. This is a very busy slide. So basically what has happened is the utilization of the hip replacement has increased significantly in the last 2 or 3 decades, like 6 times. But the biggest increase has been in this younger group, 46 to 64. So nowadays, we are seeing more and more young patients coming to us that need a hip or knee replacement. So remember at the beginning of my lecture, we were talking about कि क्या ये grandma's hip है? तो ये grandma का hip knee नहीं है. Many of us will get this procedure sooner as well. So that's another second point, take-home message is here that this surgery is now being performed in relatively younger patients. And these are some of the famous sportsmen who had this surgery, and at the age is right there. So of course, Floyd Landis, 32 years. Bo Jackson was a baseball player, then he wanted to, he was a football player, then he wanted to come as a baseball player, 30 ki umar mein, Steve Oswald, 38. Jimmy Connors, tennis, of course, gymnast. And then this is a judo guy who got it. And who knows this guy? Any tennis fan here in the house? Andy Murray. So what happened to him? Right, he had a kind of hip replacement, which is called a resurfacing, right? And of course, somebody put it on internet, so this is actually his picture, which is freely available on internet. So यहाँ पे कोई violation नहीं है privacy का. This is his surgery. So 2018 में he had this. After that, everybody has seen his game. he has won a couple of smaller tournaments, but इस साल 2023 में he was out in the second round, right? And this was the I think the London Times or some kind of an article that I think it's the Times.co.uk, so the Times from London, which says that Andy Murray is struggling for motivation after second round visit. So we'll see how it goes. But to compete at that level after hip replacement by itself is a big thing in my opinion. Alright, so this is something I'm going to deviate a little bit. What has changed? So what are we doing differently? And I'm sure this is evolving. And again, I totally understand. I kind of grew in this place. I spent 5 years of my very productive life in this hospital. So we all understand that, you know, at the end of the day, you can read the books, you can see a lot of things happening, but then you have to work with the resources you have, right? Not every place is equipped with the best of resources. So you have to see that. But at least we need to be aware of what's happening in the rest of the world as well. So joint replacement, because it's becoming such a routine project, the approaches have changed very significantly. It's a more holistic approach these days. There's a whole focus on preoperative counseling about realistic expectations, what to expect and not. Social optimization, which is definitely a problem with the US. People are homeless, they don't have anybody to take care of them, so definitely we need to have a social optimization key. After surgery, where do you want to send the patient out? Because वहाँ पे length of stay hospital का कम करना है, but that doesn't mean the patient will go home. There are other acute rehab centers जो कि patient just shift from one place to another, but then the hospital census looks good कि length of stay हमारा कम हो गया है. Psychiatric evaluation is very important, how patients perceive their joint. Preoperative surgical planning has become very, very important. In fact, sometimes it takes me more time to plan a case than actually perform it. Custom implants have come, 3D printing हो रही है आजकल implants की, or of course dispo plan we talked about, and many hospitals are actually following this pathway, which is called a perioperative orthopedic surgical pathway, which is a protocol. It's all very protocol oriented. So the goal is to reduce complications, length of stay, emergency room visits, readmissions, reoperations, and other resources. And there are parameters and EMRs, actually electronic medical records, that are tracking these things, and everything gets tracked and documented. So these are the buzzwords that we need to focus on. So you can ask me this question, so what do you guys do in preoperative optimization? Kya karte ho, right? What different you do? So as a surgeon, our role does not finish when you see the patient in the clinic. Patient dekha with that X-ray I showed you. चलो भाई, let's go for surgery. आपने अपनी secretary को हमारे टाइम में गुलाटी हुआ करती थी, लिस्ट पकड़ा दी कि भाई ये है, उसके बाद पीजी उसको रेफरल भेजेगा, पेशेंट ब्लड प्रेशर हाइपरटेंशन है, फिर वो एनेस्थीसिया क्लिनिक जाएगा, फिर वो कुछ महीनों में फिट होके आएगा वहाँ से. तो दिस थिंग्स हैव बिकम वेरी वेरी प्रोटोकॉल ओरिएंटेड दिस डेज. आजकल अप्रोप्रिएट कंसल्ट्स होते हैं, वेट लॉस की बात होती है, BMI अगर 35-40 से ऊपर है तो उस पर हम बात करते हैं. डेंटल बात करते हैं, बिकॉज डेंटल implants and dental infection can be a source of periprosthetic infections, so we have to optimize that help. Vitamin D पे जो है osteoporosis, hemoglobin A1C, आजकल fructosamine भी आ गया है, urinary tract infection, nutritional markers, because healing depends on nutrition, and we all remember Dr. Shobha काफ़ी emphasis करती थी nutrition पे, blood पे उस ज़माने में. नाक में मर्सा के इन्फेक्शंस हैं, उसकी डिकोलोनाइजेशन करनी होती है. स्टीरॉयड इंजेक्शंस भी अवॉइड करते हैं हम लोग. नार्कोटिक्स अवॉइड करते हैं प्री-ऑप. स्मोकिंग, अल्कोहल, ड्रग काउंसलिंग, स्पाइनो-pelvic relations, where there's a whole new grand round how spine and pelvis are connected and how do we change things. Machine learning tools आ गए हैं, how to optimize these pathways. Or nowadays we don't admit the patients in most cases. The patients just come on the day of surgery, get operated, and either leave the same day or in a day or so. And studies have shown that if you follow these protocols, all those buzzwords like complications, length of stay, ED visits, readmission, reoperations, and overall cost decrease हो जाता है. What has changed from anesthesia? The debate is still on, regional versus general anesthesia, although the AOS guidelines now favor regional anesthesia. Multimodal analgesia without minimal narcotics, so with minimal narcotics. So narcotics से जो हट रहा है, the US went through a huge epidemic of narcotics where millions of people were affected, they died, and there are multi-billion lawsuits that are going on in the US right now. Johnson & Johnson is one company, Abbott is another company. So उस पे जोर है. And I remember when I was a PG here, तो यहाँ तो narcotics मिलते ही नहीं थे. Like all post-op used to go on NSAIDs, that's it. No narcotics at all. Tramadol, I think when I was a first year senior resident, Tramadol had just arrived at that point. फिर Tramadol का combination भी आ गया था, Ultracetamol. The real game change in the recent last 10 years actually has been TXA or tranexamic acid, which has reduced blood management. So nowadays for a primary hip and knees, people hardly get any blood transfusions. We are not using drains anymore, and tourniquets का भी use काफ़ी कम हो गया आजकल. So these things have changed a little bit. So which is what we talked about. Now if you look at the surgeon and the surgical team, so how is it different over there? So I'll give you an overview of what I am doing it right now. So ACGME is a graduate medical education body in America, okay, US में Accredited Council of Graduate Medical Education. So now for ACGME is mandated that every resident who is graduating from orthopedic surgery has to be a part of at least 30 hips and knee replacements. If you haven't scrubbed in 30 hips and knee replacement as a first assist, you cannot graduate from the program. Simple as that. So people are getting, so in your residency, people are getting exposure to hips and knee replacement. Now 90% of the residents in the US are doing some kind of a fellowship training. Almost 90%. Now 60% of these hips and knee replacements are done by fellowship trained surgeons. So what does that mean? So what is more important? That 40% are being done by people who have not done a fellowship training in hip and knee replacement. So that is why it's very important in your residency to get that exposure. क्योंकि अगर आप वहाँ तो calls भी लेनी पड़ती है. Calls में if you are a attending or a consultant, you have to come. If there is a hip fracture that needs your expertise, you have to come. You can't just leave on the residence anymore. आपको आना पड़ेगा. And अगर आपको hemi arthroplasty तो almost सबको करनी hip fractures तो करने पड़ेंगे. As an average orthopedic surgeon, you'll have to do hip fractures if you're taking calls. And if you're doing hip fractures, you might have a case which needs a nail. You might have a case that needs a hemi arthroplasty. You might need a case that needs a total hip. So you will have to learn how to do those cases. OR emphasis में काफ़ी जोर है. How do we play around with the OR efficiencies? Staggered overlapping rooms पे चलते हैं. If you have how do you play with two rooms? कैसे run कर सकते हो? This is also a focus over there. And this was a little bit of a controversy because there was a mishap that happened in one of the rooms. So basically, there was a surgeon who was trying to man two rooms in Boston, actually Harvard. There was an ankle fracture going on in one room and a hemiarthroplasty on another room, which was a cemented hemiarthroplasty. So the surgeon left the room with a hemiarthroplasty after putting cement and just told the senior resident, who was a PGY 5, so 5th year, कि आप इसमें अब बस implant डाल के just wait for the cement to get hard, right? You guys understand what a bone cement is, right? So bone cement is basically, there's a solid piece, there's a powder, there is a liquid, there's a monomer, then you mix it, and then it becomes a polymer, right? And then it becomes hard like a cement. And then he went to the other room to do ankle fracture, and as he was doing the ankle fracture, what happened in the other room, nobody knows except that senior resident. The implant could not be pushed in, and the cement hardened much earlier. So now the implant was this much proud. So it became a big thing, and there was a lot of course, journalists and newspapers are waiting for these kinds of articles to happen, especially if they're happening in big institutes like Harvard and all. So there was a lot of uproar about this, and it was in the news. This was 2016 or 17. Then a lot of surgeons then published their data and how they do staggered room or something. So that's why I told that this is a hot topic, used to be a hot topic. So the bottom line here is more total joints are now being done by more experienced surgeons. OR efficiency is needed for higher volumes. Higher volumes leads to better outcomes. We all know that experience. And studies have shown that it's the hospital and not the surgeon that actually influences the outcome in these cases. This is a very interesting study, probably the first of its kind that we did. Because when you are playing in an academic setup, not playing basically, it's a game. But people also say that you cannot make an omelette without breaking eggs. So anda bhuji banegi to anda to टूटेगा कभी ना कभी, right? So that's the thing. So टीचिंग हॉस्पिटल का सबसे बड़ा कंसर्न क्या होता है कि भाई टीचिंग हॉस्पिटल है, सर्जन जो सीनियर सर्जन है उसकी सुपरविजन कितनी होगी, कॉम्प्लिकेशन रेट्स वहाँ क्या हैं. सो पीपल आर वेरी कॉन्शियस अबाउट getting surgeries done in a teaching hospital. So this is a study that we did. It's basically a single stage bilateral total knee arthroplasties where first side was done by me, skin to skin, and the second side I was the first assist and my senior residents was doing the case. Except the cementing part, of course. I would never not give them the cementing part yet. And this is what we found, that my mean time was 70 minutes for this knee, and their mean time was almost close to 97. So 27 minutes difference. So with proper supervision, the time is not bad. That means basically for every 3 knees, that my resident does, I am losing, it's an opportunity cost of one knee for me, approximately, right? So, and we showed that there was no increased complication, although this was not a very, very highly powered study. It's difficult to do a very highly powered study like this. So the mean time for most surgeons, I would say, is around this part. So total knees does 70 minutes, although I work with a surgeon in India who would do a skin to skin in 35 minutes, half the time that I am doing right now. Hips are actually a little bit faster for me, about less than an hour. And historically, though, 3 घंटे लगते हैं. So this has changed over the last few years. From 3 years surgery, now this has become almost an hour surgery for each side. And we are becoming actually the victims of our own success, because now the insurance companies and the other payers, this is again a different, it's difficult to understand these concepts when I was a resident here, but as you go out in private practice and learn these things, there has to be a payer for every surgery. कहीं से तो economics flow करेगा ही. And what now the insurance companies and reimbursement companies now tell that, oh, okay, now we used to pay you X number of dollars when the surgery was 3 hours, but now you're doing it in 1 hour, so we should give you 1/3. We should not give you the whole number. So basically, we are becoming a victim of our own success here. So surgical techniques have changed. Minimal invasive pe jod hai, surgical approaches have changed and they have evolved. Anterior hip surgery is the new curve, which is almost plateaued now. Implants have changed, bearing surface have changed, and of course, fixation methods are the change as well. So it's interesting that no long-term difference has been shown in most studies, but most studies are underpowered and intrinsic bias. So we have to understand that in a total joint world, the biggest problem is these implants are supposed to last 15, 20, 25 years. So if there is a new implant in the market today, just to see how long it lasts, I'll have to wait 25 years. And not all changes progress, although we assume that if something comes in the market today, Mark 2, Mark 3, Mark 4, it will be better from the last one. And that is why it's very difficult to make a study like this or design a study which can show that. And of course, is the new technology useful? We have to think about these things as well. So the benefit of a new technology means it should definitely simplify the process, would make your life easier, number one. It should improve efficiency and cost effectiveness, because cost is becoming a very big thing. And of course, it should reduce complications. Right, most of us have gone through this phase of how home video sets, Betamax sets, and floppy. Actually, my first thesis we talked about was on a floppy. I think इसकी 4 MB से होती थी इसकी storage floppy की. I think 4 MB, right? 4 MB. 4 की आती थी. 4 के आसपास आती थी. Of course, फिर CDs आए, फिर DVDs आए, फिर ब्लूटूथ आया, फिर आपका ये थंब ड्राइव में सारा आ गया, फिर ऑफकोर्स फिर वो आसमान में चला गया, क्लाउड हो गया, फिर इतना कुछ हो गया, तब तो भाई ChatGPT भी आ गया है. Right? And this is what, if you Google chatbot, this is what you get. Now you'll be seen by a ChatGPT guy, right? And of course, patients बोल रहे हैं कि डॉक्टर बहुत ज़्यादा केयरिंग है, वो ज़्यादा एम्पैथी दिखाते हैं, human physicians, of course. And primary care में दिखा रहे हैं कि they are better at their jobs. Now this is an online survey from an online patients. Medical treatment की ranking पे depend करता है. So उसमें भी ChatGPT. And interestingly, ChatGPT has passed USMLE exam. It has passed the law exam from University of Minnesota, and of course, Wharton's MBA भी pass कर चुका है. So we'll see. This is an article published in AOS that can a ChatGPT replace an orthopedic surgeon, right? So this is what we need to discuss. Number 2, can residencies use this technology to teach the basics and nuances in orthopedics, which I think is yes. Let's skip the third part. Can it help to improve patient care? I think yes. And this is where the rest of the world is divided, like is there a liability in using the technology? At this point, how many of you would go to a ChatGPT, being physicians yourself? Anybody? Raise your hand. Huh? Yeah, not for surgeries, right? So at the end of the day, basically, yes, you can take an opinion, you can double cross, triple cross, second, third opinion, right? But and that's what this paper in core was, that it cannot perform orthopedic surgery yet, right? It's a very nice cartoon that shares that, are you concerned about increase in artificial intelligence? Well, no, I am not, but I am concerned about decrease in real intelligence, and that is what's happening. And this is a nice study that was done. So what happens in a residency in the US is that during your last year, which is a PGY5, you take your written exam, which is called a Part 1 boards, and after that you go into practice. After 2 years of practice, you submit your case log to the governing body. They will look at your case logs and they will check all the complications and everything, and they will pick 10 to 12 cases out of it, out of your 6 months case log. And then you have to go and defend those cases like a PhD thesis. That you literally have to go and defend in front of a panel, and that's what you did. So I personally emailed ABOS and I told them कि मेरे पास कुछ questions, because what's happening is after you are done part 1 and part 2 you become board certified, but after every 10 years you have to recertify. Now for the last few years what they have done is you can either do the same thing, or you could read some articles from their list and the questions will be based on that. So it's kind of an open book concept, but you still have to take the exam. So I've been taking it, this was my 5th year, so I've completed my recertification almost. So now I have questions for the last 5 years because those are my questions. So I do have access to ABOS questions for my exam for the last 5 years. So I asked them, can I do a study, run those questions through ChatGPT and see how it works? They wrote a very stern letter telling me, no, you are not supposed to do that. If you do that, we're going to take your certification away and everything. So it didn't work. And then, of course, after that, these guys, they actually took a question bank. So this is not the ABOS, which is the American Board of Orthopedic Surgery, but this is a question bank. They used a question bank and they found that ChatGPT can compete or is comparable to a first-year surgical resident. But as the questions become more and more subjective and taxonomy and complexity, ChatGPT cannot. So at this point, as orthopedic surgeons, we are still safe. Let's just go very briefly about some new technology that has been in the market for a few years. So of course, there are sensors that can help you do these surgeries. I'm going to run through these slides very fast. There's a patient-specific instrumentations have come. There's a personalized total knee arthroplasty where they will get a CT scan of your knee and they will make custom implants, they'll make custom jigs and do that. But the bottom line is, at this point, no study has shown a very significant difference whether you use this personalized jig or regular ones. Surgical time does improve by 5 minutes. Not sure how important that is, but of course this is more costly. You need a CT and an MRI, and advantage is of course less strays. Computer navigation has been there, where you can align your knees much better depending on what you define them as. So this is another technology, and it's very important if canal has a tumor. So this patient had a cartilaginous tumor here in chondroma, which we didn't want to budge or disturb, so we used it here. This patient already had a nail in the femur place, so in this case, this was a good case for navigation as well. And of course, robotics, I'm sure, like I saw a lot of boards with robotic surgery in Delhi this time as I was roaming around. So there are different kind of robots. I think this I'll talk more in the next hour with my residents here. So of course, most studies have still not shown much difference between a robotic assisted surgery and a conventional total knees. That's an interesting part. Of course, I spoke with somebody an hour ago about PlayStation. So of course, if you remember, there was a Google Glass where actually there was a picture on the corner of the glass that you could see. Huh? Manish, how are you? सही टाइम पे दे दिया लेक्चर? So we'll take a break, I think, right? Yeah. I think we're almost done here. Yeah, I had some videos, but apparently लग रहा है video काम नहीं कर रहा जो भी anyway. So Google Glass आया, फिर आजकल also VR है, Vision Pro आ चुका है, Oculus का game है. So basically this is a nice teaching tool where you wear these goggles and you have these tools and you are basically playing around and doing the surgery virtually. So this is virtual reality. Now there's an augmented reality, right? So you are right there and you are trying to do things. So augmented reality we have where you can plan your cases, and this is augmented reality where you're actually operating on the patient, and then these are the sensors that gives you an idea like कहाँ क्या जा रहा है, किस angle में क्या degrees है. So these are the new things coming, and this has really gained some traction not only in orthopedic surgery but in other surgeries as well. Of course, miscellaneous closing techniques change हो गई हैं, dressing materials आ गए हैं, bipolar sealant devices आ गई हैं, hemostatic agents आ गए हैं. This is a barbed suture, actually devised by a plastic surgeon who was either very smart or very lazy. इसमें आपको knot नहीं बांधना पड़ता, you just keep suturing, and there's barbed in one direction and half of the knots are barbed in the other direction, so two surgeons can do it together and they can suture it. Again, there's no consistent evidence to prove their superiority. Complications and failures. So what has changed? Basically what has changed is infection and instability are still the leading causes of failure. In the past, it used to be the polyethylene. So the material that was used in the past was a limiting factor. Because of the change in the material, new technology, that polyethylene wear and osteolysis that you used to see in hip and knee replacements has changed very, very dramatically. Implant survival. So question you can ask me, how long these implants survive? So these are the numbers, like as if you ask me the numbers, so these are the numbers. About 82 total knees and 70% of the unis can last 25 years. But also remember, if you're doing a surgery at the age of 70, what will you be, how much running will you be doing when you're 95? So the real test is if you do this surgery in a 50-year-old. The same number for hip replacement is almost close to 80% now. Post-op, all those things are changed. I'm sure you must have heard or seen the reps coming and telling me, "Aaj cryo use karo, aaj ye use karo." Anyway, let's move on. DVT prophylaxis is a very big thing in the US and the UK because there's a lot of lawsuit and liabilities going on. We remember here we hardly used to give any DVT prophylaxis to our patients except NSAIDs, and I remember, and Dr. Jain will testify, we actually had a very young kid, probably in his 20s or 30s. His name was Ayush. Little bit on the higher side, femur fracture. He came with femur fracture. We had nailed him, and he had a sudden death in the ward 2 or 3 days post-op, and he had a massive PE at that point. So bottom line is, at this point, based on all those guidelines, everything is acceptable, including aspirin. And aspirin can be 81 OD, 81 BID, 325 OD, 325 BID. So aspirin is acceptable as well. Sports. So what about sports after total joints? Recommendations are widening, nothing specific. I allow my patients to do light jogging, swimming, running. I had a patient, but he's crazy. He jumped from a plane after getting his 2 knees done. So I just say, please do not do it again. If you break, it's going to be a big problem. So, but yes, if you were doing something before, probably you can go back. If you never skied in your life, तो आप knee replacement करा के तो नहीं कर सकोगे. जो कभी किया ही नहीं है, कैसे करोगे? This is an important part, and I think my junior friends, the medical students and interns and PGs should probably have a look at these slides. What is changing very, very significantly is actually administration, and not only in medicine, in orthopedics also. So in the US, we now have something we call a bundle payment, which we used to have here since, who knows, 30, 40 years ago. राइट कि अगर आपको हिप और नी रिप्लेसमेंट करवाना है, आप किसी भी प्राइवेट कॉर्पोरेट उसमें चले जाओ तो आपका पैकेज है 2 लाख में ही हो जाएगा, 1 लाख में ही हो जाएगा, एवरीथिंग इज इंक्लूडेड, राइट. आई डोंट नो द नंबर्स नाउ. So now since 2015 or 16, the Medicare, which is again that insurance in the US, has come out with this bundled payment models. So they give a fixed amount for a fixed number of days for these surgeries, and if anything goes over that, there's no payment. So now the pressure is on the surgeon and the hospital to reduce length of stay and readmissions and all those things. So the news is tightening. Electronic medical records, it will eventually come. Even here it will come. I don't know कि अभी क्या है यहाँ पे, but electronic medical records is something that will stay here. And electronic medical records, you have to start recording this PROM, the patient reported outcomes, and all those things will come in. So we talked about what has changed. Let's also talk about what has not changed, right? But not all change is progress, we saw that. So what has not changed is the human anatomy. It's still the same for thousands of years. Basic principles have been the same. Long-term patient outcome based on newer technology has not changed much. And patient satisfaction, especially after a knee replacement, has been consistently around 80-85%. Hips is close to 90%, so when a patient comes and asks me, how would I do? For knees, my number is, you'll be 80% better. There's an 80% chance you'll be 80% better. And for the hips, it's a 90% chance you'll be 90% better. I think the biggest discordant is the patient expectations and the surgeon's promise. So this is where we need to be transparent and be very realistic. With these surgeries, it will take you 3 से 6 महीने लगेंगे आपको, साल भी लग सकता है to reach the peak recovery, and very good chance कि आप कब ये जो hip और knee है ये 20-30 साल पहले जो था वो होगा, पर there's a very good chance you'll be much better than what you are now. And what has changed? Not for good. Paperwork is increasing. As you go out in the real world or the private world, you'll see a lot of paperwork will increase slowly and slowly here. It's a more business approach is coming. Hospital policies are different from clinical practice. Patients are becoming more of a number than humans. Bundle payment is coming. Role of administrators has increased. In the US, if you look at the number of healthcare providers, which includes doctors and nurses, since the 1970s, it has only gone up 2 times. But the number of health administrators has gone down 150 times. So for every surgeon or nurse now, there's a 10 admins working on around you. Data collection has increased. Now everything is being collected, whether you do or not. आप घर जाके बात करो कि I have to buy a new fridge, फिर देखो आपके apps में क्या आता है, सारे fridge के ad आने शुरू हो जाएंगे. So your data is being collected every single time. And so to summarize, administrative burden बढ़ रहा है, corporatization of healthcare हो रहा है, and this is the term that I coined. I haven't found this. कि physicians also becoming their secretaries. आपको अपना काम खुद करना पड़ेगा, अपने calendar खुद maintain करने पड़ेंगे. Forms electronic होंगे, आपको खुद sign करना पड़ेगा. So you are becoming your secretaries, which is good in one way, but I think it's important to have the surgeon do their job. Decreasing reimbursements होंगे, insurance and pre-approvals लेने पड़ेंगे, mediocrity in the name of diversity. I think we just talked about it in the lunchtime. और patient physician relation change हो रहा है. It's becoming more of an assembly line these days. And this is a interesting data that shows that nowadays physicians spend almost 50% of their time in the computer. So electronic medical records पे आप 50% time up करोगे. And physicians' well-being is now being linked to the messages generated in this EMR. So this is a world-famous electronic medical record system called EPIC. Jatin, do we have Epic here in Delhi? It will come. It's still a private company, family owned, and yeah, it keeps emailing you. It will send you a text from anybody, and then you can see यहाँ पे आपके inbox भर जाएंगे कि ये एक task है आपका, और जब task 0 हो जाते हैं तो आपको thank you, very good. तो अब हमारी well-being link हो गई है कि EMR में ये चीज़ 0 होनी चाहिए. Burnout, I think I need to discuss this a real bit because this has also changed in medicine when you go out of your academic thing. And orthopedic surgery especially is a real burnout. Based on the American data, about 40 to 60% of orthopedic surgeons will experience episodes of burnout through their career. 13% of orthopedic surgeons have depression, which is twice what's in the society. And amongst all the surgeons, the rate of suicide is highest in orthopedics. So of all the surgeons that commit suicide, 1/3, 1:3 is orthopedic surgeon. I think it's again a price you pay for your own success. And this is a very good article. I would encourage you to read it. It's a free online. And I totally agree with this, and most of you will. This is the price of perfectionism that we are paying in orthopedics. And of course, now you guys probably hear this news कि आज किसी ने आके किसी को पीट दिया, किसी ने किसी को मार दिया, किसी ने गोली निकाल के कर दी. So where are we going? I don't know. These are depressing news as well. So when this happened, I just close my eyes, think positive, and breathe goodness in and out. This is something that you might want to know, what to look in your surgeon, right? If you're getting your hip or knee replacement, then what do you need to look if your parents or grandparents are going it? So in my opinion, this is again what I think. Look for his experience. Where did he train? Is he fellowship trained or not? Volume kya hai, and how many years out of practice, of course. physician है या technician है, there's a very good article published in NIJM journal by Atul Gawande, who's an Indian origin GI surgeon, like how as surgeons we are becoming more and more of a technician, means we are very good at what we do, but we are losing that physician part of it. It does matter in private setup, where is your block time and where. If I have a fixed block time, that means my block time is on a Tuesday. That means even if I have 7, 8, 9 cases a day on a Tuesday, I will still complete it. The hospital will give me enough resources to finish it. अगर मेरे पास ब्लॉक टाइम ही नहीं है, ठीक है शाम को आ जाना 4 बजे, और मेरे पहले कोई केस फंस गया तो पेशेंट भी फंसा हुआ है, मैं भी फंसा हुआ, तो ये भी ज़रूरी होता है. ऑफ कोर्स कॉम्प्लिकेशन रेट्स देखने पड़ते हैं, हाउ द सर्जन्स हैंडल द कॉम्प्लिकेशंस. आई थिंक depending on how the surgeons are, everybody looks at surgeon differently, right? The nurses look at surgeons कि भाई कौन कितना चिल्लाता है, कितनी गालियाँ देता है OR में, right? And anesthesia वाले देखते हैं यार इसने 2 घंटे बोले, इसके 5 तो नहीं हो जाएंगे, 2 में ही हो जाए तो अच्छा है, right? As a PG and junior faculty, we see कि when complications happens, how does he handle it? Can he handle his own complications? Does he shirk back from his responsibilities? So I think that's very important. हॉस्पिटल में हो रहा है, अब आजकल तो एम्बुलेटरी केयर सेंटर भी बन रहे हैं दुनिया में, यहाँ भी आएंगे कभी ना कभी, नहीं आए हैं तो वी नीड टू नो कि सर्जरी कहाँ हो रही है. एम्बुलेटरी केयर में हो रही है, अगर वहाँ शाम को कुछ कॉम्प्लिकेशन हो गई तो पेशेंट कहाँ जाएगा. वी नीड टू नो दैट. ऑड आवर्स हैं, और प्लीज़ ट्राई टू सीक अदर रियल पेशेंट्स एंड देयर एक्सपीरियंस, not on the internet. Don't read blogs and don't read the stars and everything, okay? So this is important. I'll end with a couple of my own cases where we use some of these technologies we talked about. So this is a very young female, 45 years of age, morbidly obese. You can look from the thigh size. She was BMI close to 43, 44. Came with a windswept deformity. We're done? All right, just finishing off some of the cases we did. Patient with multiple implants, computer navigation. Patient with post-traumatic arthritis deformity came with this deformity. Straighter. This is an allograft, and of course, I would just end by saying more and more data is being gathered as we speak. Thank you so much, my awesome mentors, my friends. I really owe a lot to UCMS, and special thanks to everyone. Thank you. Any questions, please? Yeah. Yes, sir.
There's another meeting, people are waiting for that. Just one question. I am from Department of Surgery, a professor of surgery, and I represent a learned layman. So I have listened to your lecture from A to Z. The only thing which I have not learned anything from you is what is the genuine indication of doing any of these replacements. I feel, this is my feeling and the feeling of the public, it's just a hype in which you people along with the media are just forcing people to get replacements done. I'm making a very strong statement.
That's a genuine question, and it's not that I didn't expect this. So indications are, again, it's not 4 or 5 indications. Yeah, we have a very good example in the house today who had his knee replacement done, and you wouldn't even know that. So when we talk about satisfaction rate, 90% of the patients are happy that they did the surgery.
Once I spend 5 lakhs, I will be happy.
No, not always. You will not. The problem is, अगर आपने 1 लाख का जूता खरीदा और आपको चुभ रहा है, आप दुनिया को बोलोगे आप खुश हो, लेकिन आप मनी मन नहीं होगे. Yeah, and इसीलिए Lancet called this surgery as the operation of the century, which was the 20th century. It was it says it's in the Lancet, and you can read that article. And why is it called? Because it has the ability to change your quality of life. Of course, we are not saving lives, that we think, but if you look at this, quality of life से आपकी longevity और आपकी survival पे बहुत फर्क पड़ता है. Indirectly, we don't emphasize on that. If your quality of life is not good, your longevity will definitely decrease.
Thank you, sir, for such an interactive and session.